welcome to The Extra Mile. I'm Linda Boudreau. Our guest today is Aimee Stevenson. Aimee is the executive director and CEO of Paramount Hospice here in ACADIANA. She is also the National Hospice Director-elect for our region. And so she kind of has her hand in lots of different aspects of hospice and the work that hospice does. So welcome, Aimee. I'm really glad you could make it today.
Thank you for having me.
Initially, what I'd like to do is talk a little bit about hospice in general, what it is, why it matters, and then we'll get to the specifics in a few minutes about the veterans.
Okay.
Okay, so what is hospice and why does it matter?
Hospice is end-of-life care. It's for people in the last 6 months or some longer of life, and it's to make the life that they have left as full of quality as possible. If we as hospice workers could fix someone's illness, of course we would, but unfortunately we cannot. But we can offer our services, and it's our honor and privilege to be able to take care of people at the end of their life. There are many things that set up end-of-life care differently than curative care.
Right.
And it's very important from a end-of-life care model versus a curative care model to offer people the hope and courage that they need to be able to face their last days and have everything set up for themselves and their family. A big portion of hospice care is bereavement. And at Paramount Hospice, we like to offer bereavement services as soon as possible so that our families, our patients and families get their final wish. We have right now a patient who is young and has a young daughter, and it was her wish that her sons and her husband not be the people to discuss the birds and the bees. So part of her bereavement plan is having one of our nurses, when the time comes, the daughter's still too young, but when the time comes, have a medical explanation of the birds and the bees so that she's not learning from brothers and men, and there's the female component. So different families and different patients have different offerings of what they want to hear, what they want to know about, what they want to pass on. We have one of the things that we like to do is have our patient write up, if you will, a note for their child on their wedding day, or a note for high school graduation or college graduation, or the day they have their first child.
So some kind of message that can follow after the death, but can be so they can have a presence at a monumental or momentous event. Is that kind of what you're saying?
Absolutely. And bereavement is meant to be for at least 13 months after the person passes.
But let me ask you one thing real quick, because you talked about bereavement for the patient also. And we hear a lot about bereavement for family members and, the whole process of grief and healing from grief. What is that bereavement component for the dying person? What does that mean?
So if they have a wish, if they have a plan of what they want their funeral to look like, or their life celebration, or they don't want an open casket, they would prefer a nice picture be placed on their coffin. So depending on, each person is a little bit different. So we pride ourselves in individualizing the plan of care for whatever it may be.
Okay.
Each person's individualized decision of how they would like things handled. Some people haven't thought of it. Some people get ill and don't have a lot of time to think about it. Some people have been thinking about it their whole lives. I have friends who have said, please don't let them show my face in my coffin. Please, I want to be beautiful and I want to look exactly the way I look. Please don't let them show my face. So I think that each person brings in their values and their thoughts of what they want to experience or what they want to have experienced after they're gone. So I like to say bereavement starts upon admission, and our bereavement coordinator meets with the patient and the family to discuss what they would like to see. Most of the time, bereavement lasts at least 13 months. So bereavement is for a set of holidays.
But that's for family members, surviving family members.
Surviving family members, right. After the patient passes,
right,
then we have a year and then a month for the date of the loss.
Okay.
We can extend that as far as we like. Most people we do extend, and we continue having them to our memorial services annually. but we want to do it at least for 13 months to give them the structure and the support that they need. A lot of people right in the beginning are not ready to have that conversation. Not ready. I need to get all my affairs in order. So we go individualized with the patient and family and what they would like to see and roll with their tide.
Because it's their experience.
It's their
and really, it's about honoring
Absolutely.
the individual and the family. But you do a lot of interesting work with veterans as well.
Yes, we do.
So we have the just, our hospice population in general, but you have a specialty, don't you?
I am the LNIC provider, the LNIC trainer for this area. And LNIC is end of life
Something or other.
Something or nursing coalition. And so I have been trained by the VA and by LNIC to train the trainer, if you will, on how to take care of the veteran population.
Is that a big deal?
It is a big deal because very often people don't realize that they're even a veteran. They don't realize that if you served our country in whatever capacity, that makes you a veteran. So we want to make sure for the people, it's not just people during wartime. It's not just people who were in the National Guard are veterans. And there's all these benefits available. And we want to make sure that people get what they have earned. They have served our country. They have done all these things. They don't talk about it very often. They don't realize the value that it brings to all of us non-veterans. And we want to make sure to honor them in the way that they have earned honor. The National Hospice and Palliative Care Organization has a program called We Honor Veterans.
Okay, what is that?
And it's personalized training for hospice staff in specific disease-related illnesses. So Agent Orange, post-traumatic stress disorder, depression. The highest rate of suicide is among veterans.
Yeah.
And we are not, as a nation, have not necessarily been equipped to appropriately care for that because a big part of the healthcare system is reactive. So until something happens, we aren't real proactive in things.
Right.
So in hospice, we've decided to be proactive and to educate our staff in all the different veteran situations. So there are four or five levels of We Honor Veterans program, and they want us to educate our staff and educate our community and make sure our community knows that every veteran should be buried with a flag on their coffin. Every veteran is entitled to some veteran benefits, from burial benefits to aid and attendance, which is where the VA will pay for a veteran or their surviving spouse to have aid and attendance, which essentially is a 24-hour caregiver for them in their home setting. If that's in the nursing home or their house or what have you. It can be their wife who knows how to take care of them and she can be paid by the VA. It can be their paid caregiver. It can be their child. But whatever it is, it's to take care of them during the hours that they need. There are some rules that you have to follow to apply for it appropriately. But it's something that's there that's very underutilized because people don't realize that it's a benefit for them.
I know my dad is a veteran, and he goes to the adult daycare center, and that's covered through as a VA benefit, which is really it's huge for us.
Absolutely.
It keeps him safe during the day and gets him out, and he has some interaction.
And it allows you to work.
Yes.
And it allows your family member to work and know that he's in a safe place and not home alone being bored or what have you. So there are great programs out there, and the LNIC training course helped me learn about those programs and be able to further our knowledge here in Acadiana to take care of the veterans we have here. We have a huge population
We
of
have
veterans.
a lot of veterans here, I was listening to some remarks that Rudy Borkin made at the Memorial Day service, and he was saying that we have more young men from Lafayette High who have been killed in combat than any other high school in the country.
Wow.
So not only do we have a lot of veterans, we have a lot of our young people who are really going and making that ultimate sacrifice. And so it is important that we respect those who serve. So in addition to just providing specialized services, what about the living history that our veterans have to offer?
So there's another program, and I'm glad you asked about that, called the Veterans History Project. And it's where the community, if you will, and the hospice community especially, films a veteran's situation. So their story about what they did while they were in the service, and edits it and makes it very pretty, and then we put it into the National Archives. And it's fantastic. There's the National Archives launched Inside the Vaults, which is a video short commemorating veterans, and Veterans Day was a very big day for them. What I have done in the past and what we're doing now is filming stories about veterans, and they don't have to be on hospice, just about veterans, so that when the time we get all of their stories into the National Archives and learn from them, and when the time comes that their family wants to know what went on, it can be passed along to further generations, because it's great to know what all these people have done for us. Most often, veterans who are very decorated and who have done a lot, that was their day-to-day. They don't realize what a big deal they are. Yeah. And they don't gloat. So it's better to have Aimee come and toot their horn than them toot their own horn.
They won't do it.
They won't do it. My grandfather figure is from Iraq, where I'm from. His name is Mr. Lee Bernard. And last year, he was the French Legion of Honor award winner from right here in South Louisiana. It's huge.
That's huge.
And all of the things that he did to earn that award were because he spoke French. So no one too much discussed it, but while they were in the war, he was on a tank battalion, and a lot of the people did not speak French, but he was very fluent, and he spoke French, and the Germans thought he was French. So he saved all these men's lives and negotiated different treaties and what have you to allow for the safe passage of all these Americans.
Wow.
And he's never talked about it. I would have never known about it. It happened to come our way, and we found out about it, and some of his family members nominated him for this award, and of course he won with flying colors and went to Paris and had a wonderful time, and we're all very proud of him. But even that happening last year in Iraq, it wasn't presented as much in the news as it could have been, because it was a huge deal. They honor 50 men a year, and he was honored last year, and we're all so proud of him. And he's the closest thing I ever had to a grandfather. Both of my grandfathers were gone before I was born. So he's been everything grandfatherly that I've ever known. So to hear all these stories, and now he'll talk about it a little bit, but it's hard for him to discuss. He can have different dreams and whatnot and not want to discuss a whole lot of him. But if there's him in a small town like Iraq, think of how many more stories we don't know about.
Exactly. And I'm thinking, no matter how humble or modest the story is, you know, it's a piece of the fabric of someone's life. And to have that piece, to have that information for generations to come, I think it's very rich. I think it's a wonderful project. Are you doing it here in Acadiana? We
are doing it here in Acadiana. Danny, one of the Acadiana Open Channel's cameramen, is helping us to film, and we're doing a short video for each of them, and the Hospice Action Network in DC has asked if they could use some of our stories to present to Congress, to the Ways and Means Committee, to discuss hospice care and how it's utilized in South Louisiana. And they've also put some on YouTube, which I'm still a little new to YouTube, but it's where you put a video on the internet and people from all around the world can view it and hear about what you're talking about. So they've asked us to be one of the pilots for this program here in Lafayette, Louisiana, and film different people, not just hospice patients, anyone who wants to talk about hospice or about anything to do with a veteran program, and put it onto this video, and they edit it and do all the wonderful things and put it on YouTube, and we'll get to watch it. And it's very exciting to have someone from small town America, if you will, be on this national stage and be able to watch all of our staff members really excelling to be able to do this project.
And to just realize that the technology today allows us to really have that global reach.
Impact, right.
Yeah, it's a very big deal. So if somebody wants to participate in this, how do they do it?
So they can call my office. I think that the number is on the screen. And we have a volunteer coordinator who is in charge of the program. We have a steering committee, so if there are any any civilians or veterans who want to be part of our steering committee. We welcome everyone, and we're going to film 5 stories a week. So Monday, Tuesday, Wednesday, Thursday, Friday, film a story a day, and then we'll have film students edit it for us. And the National Hospice and Palliative Care Organization, they will edit their portion to put on YouTube, but we're going to edit the ones here, and we have a Facebook page. Paramount Hospice has a Facebook page, and we will attach these videos to our Facebook page so that anyone can like us on Facebook and view all of these videos and see all the different stories about the important veterans in our area who have done wonderful things that we don't all necessarily know about. So it's a fantastic program.
It's a great idea.
We're very excited about it.
Now, how does hospice, who really, looks at end-of-life care, how does hospice fit in with the whole preserving the legacy story piece of it? Because they may not be anywhere near end of life. They may be still, healthy and running around and doing all kinds of stuff and have another 50 years.
Absolutely. So the way that we got involved in this is the National Archives put out this program, and one of the things that we've done to provide back for our community is our volunteer project this year is about the veterans. Okay. So this is how we at Paramount Hospice chose to celebrate the veterans of this area. They don't have to have a terminal illness at all. This is just us giving back to our community and allowing us to service the people who give us our freedoms every day. Yeah. So we're so grateful to them for what they've done historically that today we want to honor their legacy, and this is the best way to do it.
Can they be young from one of the recent wars, or does it have to be somebody from Korea, World War II?
It can be any veteran and any veteran surviving spouse.
Oh, okay, spouses too.
Absolutely. We invite everyone who wants to have any part of it, even if they want to be in the office filing things, to help us. We're writing a grant to be able to do this on a larger level. So if there's anyone who knows how to do any kind of grant writing or anything to help with this program, we welcome them. The more the merrier. Mr. Rudy Borg is our steering committee chair, and he's been very involved and very helpful. He's very involved in the veteran community in this area, and we're honored to have him as one of our program chairs.
Now, Paramount Hospice, as we said at the beginning of today's show, does serve the general population. But you have, I guess, identified the veteran population as one that needs special care or that deserves special care. And so what is it that makes the veteran population different in terms of end-of-life issues?
So one of the things that we've learned in our trainings around the country is that they definitely deserve special care, but everyone deserves special care at the end of their life.
I think that's a huge part of anyone's life.
It's a very special time, and it's our honor and privilege to be able to take care of these people during this time. From a veteran standpoint, there are so many service-related illnesses. Because of the large veteran population we have here in South Louisiana, we want to make sure that we customize or tailor a end-of-life program to what a veteran needs. So we've done specialized training. All of my staff has done specialized training to be able to deal with different service-related illnesses, be it Agent Orange, post-traumatic stress disorder. There are so many things that happen in a veteran's life that we want to make sure at the end of their life we are aware and can take care of each little thing, because at the end of the life you really deal with what you optimally would have been dealing with all along. So we want to make sure that none of these things come back to haunt any patient or family, and that we have them out in the open. We're honest and open about it, and we know how to deal with it, and we don't file it in a drawer somewhere, never to be heard from again.
Okay, I guess I'm trying to get a visual idea of what that means. So if, say, a veteran has been exposed to Agent Orange, how does that affect end-of-life issues? I mean, what does that do?
There are different respiratory things. Okay. There are different physical symptoms.
So part of it is you need to know physically what it's going to do to somebody, so you know how to treat.
Correct.
And how to manage pain and that kind of thing.
Exactly.
Am I getting that right? And I guess the emotional stuff like PTSD, I guess knowing that would help you to deal with some of the anxiety, the outbursts.
And For example, one of the things we were taught in our training is if someone was a POW and they were put into a small box or what have you, and we think that we're nurturing someone and wrapping them in a tight sheet and keeping them nice
Like
and
swaddling
close,
our
swaddling
babies.
like we do our babies, and that's the furthest thing from what they really need. So it makes us aware. It helps us realize that what might be comforting for me might not be comforting for someone else.
Okay.
And so it makes us aware of some of the issues that historically have come up with other veterans that we've learned from how to deal with, or what different assistance to offer so that we don't make the same errors that some other people have made in the past. It just makes us aware so we can better treat.
Okay. And in terms of bereavement work for families,
Mm-hmm.
is there a difference in the bereavement for family members of a veteran versus a non-veteran?
If there were situations that the family knew nothing about, and at the end of life the issues come up, and the family had no time to deal with it with the person, those things can come up. And so we have support groups specifically for veterans. We have regular support groups, but we have support groups specifically for veterans and volunteers that are specifically veterans from each different
Okay.
conflict, each different war, so that apples to apples are speaking to one another. If it was a Korean conflict vet, we have a volunteer from the Korean conflict who can discuss things that maybe he will never discuss with his wife, that he can discuss with his comrade, and they can talk about things that maybe he never needs to speak with his wife about it. But at the end of life, he can bring these issues up in a safe, caring environment with no judgment and no problems, and work through whatever it might be.
I just got it. So let me see if I can say this. So for our veterans who've carried silent burdens within themselves for all these years, if you have a peer for those end-of-life moments and those end-of-life discussions, people can kind of let it go and die at peace. Is that what we're... That sounds very
Absolutely.
powerful now that you put it that way. And why is it important to have people from the same conflict? In other words, why not a Vietnam vet with a World War II vet?
In a perfect world, it's from the same conflict. Any veteran with any veteran is better than nothing.
Right.
But from the same conflict or same war is better because they know what each other went through. They know if they were, whatever it might be,
Yeah.
if they were in France and dealing with that issue, or if they were in Pearl Harbor and whatever it might be, it works better if they're speaking the same language.
Right, and that does make a lot of sense. Earlier today, you talked about suicide, which of course is not a hospice issue because there's no planning time. But in terms of some of those real big issues with veterans, does hospice have any kind of role in that?
Unfortunately, suicide is a hospice issue
Is
because
it?
at the end of life, especially in painful illnesses, people can get to the point where it hurts so much that they just want to take their own life.
Yeah.
We've had that situation very recently, where someone, you know, they're serious if they have a plan.
Right.
And so when they express to us that they have a plan, we formulate a plan to get them to a safe place, whatever that might be for that particular person, and do what's best for them. We do not do any kind of assistive suicide in Louisiana. It's not legal, and it's not something that we're prepared or equipped to do. But there are those people that do take their life into their own hands because of the pain that they feel. So from a hospice standpoint, we're all about safety. We're all about comfort. So if we can get them to a place of comfort, then suicide gets taken off the table, if you will.
Right.
Can we prevent every suicide? No, we can't. But through awareness and through education, we're very attuned to what the symptoms are. People typically, if they have a plan, they start planning other things. They might, behind their spouse's back, go pay for their funeral or arrange those things. So we in hospice are aware of those things, and it's part of our plan of care to assess for that during every visit.
Okay, so you don't just assume that it's not going to happen. You are prepared for all of that.
Absolutely.
In the last couple of minutes that we have, I know we've talked a lot about the veterans, but again, I want to go back to what hospice is. Hospice is palliative care, right?
Correct.
What is palliative care? What does that mean?
So the hospice Medicare benefit is starting to include the palliative care model. And what palliative care is a comfortable way to finish your life. So the hospice Medicare benefit says that a patient has 6 months or less to live.
Give or take.
Give or take. Medicare wants a person to age in place. So in Medicare's perfect world, no one would ever go to the hospital, and we would control all costs by keeping patients at home. Well, we all know that's not really reality.
Quickly, because we have 3 seconds.
Okay.
So
taking care of people in their home setting, in a comfortable environment, whatever that means, is what palliative care is about.
That's what we do. We're out of time, and we're just getting started. Thank you so much.
Thank you for having me.
We have been talking to Aimee Stevenson. She is with Paramount Hospice here in Acadiana. I'm Linda Boudreau, and you've been watching The Extra Mile.